be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see. So I will fight if you'll fight. Yeah, I will fight, but only if you'll fight. Oh, we can make it through this like sailors in a tempest. Like sailors in a tempest together. And it could be just you and me. We'll be family. Just wait and see.
Good evening, everyone. Welcome to tonight's Lung Cancer Living Room. Happy holidays to all of you. We're so excited to have everyone here in the room tonight, all of those of you who are signing in online, as well as those of you who are coming back to watch post live. Welcome, welcome, and happy holiday season. Tonight, as most of you know, especially some of the veterans, what we typically do is our patient roundtable, and then we cut for a holiday celebration. Kim Shapoister, who most of you know, who's sitting right over here, has done an amazing job at either preparing and or picking up holiday food. So I wanted to make sure to give a huge shout out to Kim, who was cooking in our kitchen today. So thank you, Kim. Tonight, like I said, is going to be a roundtable. So I want everybody to share. A lot of times I ask people to kind of keep it brief because we usually have a speaker here who's talking about the topic of the evening. But tonight's really about all of you in the room, all of you watching online. So please give us a little bit more detail about who you are, why you're here, whether you're a caregiver or a survivor. We want to know your story. So for those of you who may not know, I'm Danielle Hicks, and my job at GoTo is to oversee all things patient-related, so patient education, patient support services. I work with an amazing team that really isn't just patient support services across the board. No matter what we do at GoTo Foundation, we are all here for you. So I'm going to ask David to introduce himself. Rick, come on in. There's a spot over here next to Katarina, unless you want to grab some food first. I'm going to ask David to introduce himself, and then we're going to go around the room this way, so you're going to be up first, Rick. And for those of you online, this may not take the whole 2 hours. It may tonight. If it doesn't, I hope that while we continue along with our celebration here after we shut off the cameras, that you will continue on with your celebration wherever you're watching from. So, David.
So, David LeDuc, and I am the Chief Strategy Officer for the GoTo Foundation. If you're wondering about Chief Strategy Officer, basically I work with all these crazy cats to take all the initiatives that we're working on, try to put it into some type of a cohesive strategy, and then figure out who the partners are we want to work with to move it forward. And then more importantly, try to make sure we're on pace week to week, month to month, and year to year in reaching our goals. And so whether the goal is to increase the number of patients who are being diagnosed early stage or trying to make sure people are getting molecular testing, I really get to work with an amazing group of people and try to drive and move that forward and make sure we're on track. I want to echo all of Danielle's welcome. It's so great to see everybody here and join everybody here tonight. Normally I'm online, so hello to all the Facebook folks who are online watching. And Danielle encouraged everyone here to please take a little bit more time telling your story and sharing your story. I'm going to encourage the people who are online to do the same tonight. Maybe take a little bit of extra time to type up why you're online, why you're listening, and share that information and create a dialogue there as well. It would be really great to see that.
And where you're signing in from. That's always kind of fun to be able to tell people where we're signing in from. And before we move to Rick, some of you might notice that David's with me tonight instead of Bonnie. As you all know, she has been working tirelessly and traveling way too much. And next week, she's having about 70 people at her house for Christmas Eve. So we needed to ensure that she doesn't wind up with something worse than just the common cold. So she is signed in from home and obviously sends her love to everyone. Right? Oh, and don't forget your mics. Hi.
Hello, I'm Rick. I'm Tina's caregiver, but she gives me more care than I give her. And I'd like to say a couple things. Number one, happy holidays for everybody. And I'm really proud of something, is that Tina and I are taking our family to Puerto Vallarta over Christmas. So we'll be there for our 50th wedding anniversary.
Woo!
That is awesome.
And I'd also like to say to Barb that she and her family put together a great celebration for Dave. It was very, very fantastic.
Here, here.
That was nice. Happy holidays to everybody. That's the most important thing, and we're all here together is really good. This is kind of just a little funny side note, but I went to a speaker, Sanjay Gupta, the doctor, and it was in San Jose, and he was asked, what's the number one thing you can do for a long, healthy life? And he said, you're doing it right here. You're with your friends. You're out with your friends. And here we are. It's a really great group of people here. My story started 9 years ago. I just passed 9 years. And I was diagnosed at stage 3B. And I tested positive for the EGFR mutation right away. So that was, they told me I was really lucky. And I thought, oh, yeah, lung cancer. I'm really lucky. But anyway, it's worked out really well for me. I did do chemo and radiation. And then after treatment, and there was no sign of any cancer, active cancer, I started back on Tarceva. I took it initially and then went off. And I went back on it and as a maintenance, and I've been on it ever since. So my doctor doesn't quite know why, but he says, let's just keep the course, stay the course. So, yeah, and I'm happy to be here.
Thanks, Tina.
Okay, I'm Joanne Berridge, and I was diagnosed in September of 2016. But before my story, with me tonight are my sister Marion, David, her significant other, my dear husband Ron, and they're too shy to talk, I guess.
That's okay. Nobody's required.
Marion said she cries when she and I do want to underscore what Rick said about the absolutely lovely tribute. Now I'm going to cry. That Barb and the family put on for Dave. It was amazing. And he was amazing. And the more we listen, the more we know how amazing he was. Okay, back to me. It was September 2016, and I had been complaining to my primary care physician about a cough for a year before that time. And I was sent to allergy, to ear, nose, and throat, diagnosed as postnasal drip, as acid reflux. I was trying to say GERD, but I knew I didn't want to say that. acid reflux. Finally, after it was a year's time, she did an X-ray, and there was a mass in my right middle lobe. Scans revealed that I guess first thing that happens is the biopsy, right? And then the scans, whatever the order was. The biopsy showed that it was malignant. It was then the subsequent tests that it was non-small cell lung cancer with the EGFR mutation. And yes, Tina, the doctor we're very lucky that you have a marker. Okay, it's lung cancer, but I guess if you have to have lung cancer, it is a kind to have. Then the scans showed that it was stage 4. It had metastasized to bone pretty significantly, my shoulder, my spine, and hips and so forth, and one small spot on the left adrenal gland. It takes about 2 weeks for all that to come together, and we all know that's a very anxious time when you just really don't know what's next. But I started on Tarceva. I was on Tarceva for 2 years. The Tarceva, I did bring great shrinkage. It was a dramatic, within 2 months, it was a very dramatic suppression of what had been there. The bone mets were entirely gone. The lung was decreased from 5 centimeters to under 2, and the adrenal gland, which hadn't been large to start with, was smaller as well. And that held for 2 years. I did have one side effect that I guess is a little bit unusual but not unheard of. I developed a lot of scabs on my head, which resulted in my hair coming out. And I was pretty bald. I was bald for almost a year, and now it's back with a vengeance. So that's great. 2 years on the Tarceva, and then I was at about that time, I had gone into a research study at Natera for blood biopsy to detect progression, not original diagnosis, but progression of a known cancer. And so they take your tissue and they do something with it, and then they can compare what's going on in your circulating tumor DNA from blood draws. And about the second or third one of those began to show an uptick in the circulating tumor DNA. So I have 2 oncologists. Dr. Blakely at UCSF ordered a Guardant test to see what was going on with the blood, and it showed that there was T790M. Now, nothing would show in a scan yet, but it showed the T790M in the blood, and so I immediately changed to Tagrisso. Just coincidentally, to remind everyone, that is exactly at the time Tagrisso became approved as first line. So may have been Tagrisso from the get-go had it been 2 years earlier than that. Anyway, I've been on the Tagrisso for a year, and the side effects are much milder than the Tarceva, and I really have no complaints about it whatsoever. It too did a dramatic drop from where the blood circulating tumor DNA was. It went to 0. It stayed at 0 for almost a year. And then in October, and this again is still through the Natera blood tests that I'm learning this stuff quickly, it started to go up a little bit, and it went up a little bit 2 months in a row. So had a CT scan, and it showed something suspicious with the adrenal gland. Had a PET scan last week, and it did show that the adrenal gland has become active. So I am scheduled to see Dr. Schiffner and about radiation of that spot. Everything else is still suppressed. The lung is suppressed, and the bones are sclerotic, which means they have holes in them from where the cancer cells were. But no cancer there. And that's my story.
Thanks, Joanne.
How do you spell sclerotic?
Same way it sounds.
Yeah.
Same way it sounds.
With a C.
We wish you all
Yeah.
happy holidays, and I second what Rick said about Bev and the memorial. It's wonderful. A wonderful fellow, by the way.
Well, while we're passing the mic real quick, I want to go back to Joanne's story. There are a whole bunch of things in there that I hate hearing about the misdiagnosis at the beginning, but since then, they've done everything right. But I want to go back to that really quickly. I don't have the data in front of me. I'm kind of a data geek. I normally have my computer in front of me. But I think our registry shows about 67% of patients are diagnosed with something else besides lung cancer upon symptoms. And I'm just curious in this room, for those who were diagnosed, how many of you were diagnosed with something other than lung cancer when you first went in? All right, so pretty significant. And Bonnie's story obviously is the same, that it took her over a year and her own self going out and doing the testing. I mean, that's a real common thing. And so it would have been great if it would have been caught earlier, but certainly since then, being retested at progression and all the things that you've talked about have been huge. And then, of course, the trial with Natera. So thanks for sharing that. That's, I think we're seeing that. It's being tracked. It's being followed. And it's something we're seeing more and more in our registry and indicative of helping us better educate, I think, people about what the symptoms are and those conversations with their physicians.
Yeah, that's great. And speaking of progress on things, I also would like to mention that Dr. Blakely at UCSF has a trial underway that is combining Tagrisso with another drug whose name I forget, that is suppressing the aurora kinase A protein that inhibits Tagrisso. And if this hadn't been just the little blip in the adrenal gland that could be taken care of otherwise, I would be in that trial. But that's still out there for me if anything progresses further.
Thanks for sharing that. I hadn't heard about that.
Well, that's why I brought it up. And it was interesting. I'll bring, you said we could talk a long time.
Yeah, please.
I'll bring,
what else do you have to say?
Well, what just occurred
we didn't know
to me,
about it.
when I first had this blip in the blood test, I couldn't get an appointment with Dr. Blakely right away. So we had, and it was the first time I've ever done this, we had a video appointment. And I had read about the trial in the EGFR resistors newsletter that we get weekly or every other week, however often we get it. And so I had printed it out so I could ask him questions about it. And so as we're having the video appointment, he said, now, depending on where this is going, I have a trial underway that you would be a good candidate for. And I said, I have the trial right here. And he said, well, I guess somebody's informed. And I said, well, you know where it comes from. It comes from the Adario Go-To Foundation.
Adario.
That's amazing, Joanne. And I just want to, for those who, I know that most of you in the room know this because we are constantly kind of beating the dead horse about patient empowerment and education and really understanding your lung cancer because it's so different for everyone. And I think Joanne's story is a testament to somebody who's really paying attention to what's going on, not only with yourself, but what's going on in the lung cancer space to ensure that you're aware of your next steps, even if your doctor may not be.
Yeah.
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 My name is Jennifer, and I was diagnosed in August of 2018.
So I think, yeah, you might just need to talk a little louder. They work mostly for the people on the...
Okay. Is that helping any? Yeah. Is that better? Okay. I was diagnosed in August of 2018. I happened to be in Reno at the Hot August Nights car show with a big group of people. We go every year, and the second day in, I started to not feel well, and we were at a restaurant, so I stepped outside, and the next thing you know, I was being rushed to the hospital. I had 3 seizures on the way to the hospital and a grand mal when I got there. And my husband was told after scans and all sorts of information, you know, testing and so on, that I had stage 4 lung cancer. I had 3 metastases in my brain. I had it in my C3 spine, my adrenal gland, and in my hip, and was sent home. I stayed in ICU for the weekend and was sent home on Sunday and taken right in very quickly with Kaiser. They acted very well, very responsive. Within a few days, I had a biopsy taken. And within about, I want to say a week, it didn't seem like it was a long time, but there's so much going on at that time, you kind of lose track. But I do have an EFGR 20 positive with PD-L1 expression. and they started treatment within a couple of weeks. So I started off on a triplet, what was cisplatin and Ellipta and Keytruda, and did that for 3 treatments or 3 cycles. And then I went just on the Keytruda and the Ellipta, and have been on that now for a year, and very successful. I did have radiation to my brain, not full brain, but I think they call it SRS, stereotactic radiation. But I only needed 1 treatment to the Mets, and that haven't had any other treatment since then, and they're gone. I just have 2 little inflammation spots that they're watching. I had radiation to my spine, but it was through my throat. So it was pretty painful because it basically burns on its way through. But so that was probably the worst treatment. But everything else was treated with the cisplatin. They didn't do any treatment to my hip or my adrenal gland directly. So whatever they were pumping into my bloodstream was working. So I've been stable since then. My scans have all been very positive, no progression at all. I'm seeing Dr. Liu in Kaiser San Francisco, and he was very involved in a clinical trial for the exon 20, and so that's in our back pocket if I should need it. We were able to, we just went to Puerto Vallarta and came back after a week, which was just lovely, and I was able to take a break now for 2 months from my treatments so I can enjoy the holidays. So I haven't had treatment since November 1st, and I'll resume on January 3rd. So I'm very happy about that. It's nice to have a clear head and give your body a chance to kind of detox a little bit. But so for me, it's been good news so far, and we've got a treatment ready if something should progress. But I want to go back to my regular treatment because I really tolerated it well, and you never know with a new treatment how you're going to tolerate it and what kind of side effects you're going to have because all of us are different. But so far so good. So that's my story.
And do you say 2013 then? Is that what I heard?
2018.
2018. Okay,
Yes.
I'm sorry, I heard that wrong. Okay.
No, yeah.
Because I was going to say that would have been very early into the time. Yeah, okay, of development of IO.
2018.
All right.
So it's just been over a year, 14 months. Yeah.
Thanks, Jennifer.
I was 2013.
I was thinking ahead.
My name's Larry. I was diagnosed in January of 2013. It was an accidental diagnosis. I had a cold, and it went into asthma, which I've had recently as well. And I had that multiple times over the last many years when I had a cold. But I went in to try and get the asthma under control, and the doctor in urgent care decided it was a good idea to take a chest x-ray to see if I had any pneumonia or anything else. And the chest x-ray showed a spot on my right lung. CT scan, PET scan, biopsy, brain MRI, stage 4 non-small cell adenocarcinoma with EGFR mutation. And that was my Valentine's Day present on February 14th of 2013. I started chemo because there were no targeted therapies approved as first-line treatment at that time. Chemo worked very well, including suppressing the brain metastasis that I had. And I continued on chemo for all of 2013 with really good results. Good enough that my oncologist and I decided that I would go on a chemo holiday. And I was fortunate enough not to progress systemically for a whole year. In April of that year, my brain metastasis showed up again, came back. And there was initial diagnosis was 1 brain metastasis. In 2014, I had 3. So we did stereotactic radiation on those, and it was successful, although over the course of the next 3 years, 1 of those metastases continued to grow, and eventually in January of 2016, I had that metastasis surgically removed. And brain scans since then have been really good. Once I progressed in January of 2015, systemically, I started on Tarceva, and it lasted for 28 months or so. September of 2016, I progressed. I started on Tagrisso because that brain metastasis that was removed in January of 2016 had next generation sequencing done on it, and it showed the T790M EGFR progression mutation. So I started on Tagrisso. I've been on it for over 3 years now. No metabolic activity systemically, no brain metastases visible or showing any. The old ones are still there, but no metabolic activity anywhere, and I'm very lucky, very fortunate, and I'm always happy to be here in the living room because there are a lot of great people here, and we share a lot of unfortunate experiences, but it's nice to share it with people who understand.
Thanks, Larry.
Hi, everyone. I'm Ina, and I'm really happy, Barb, that you're here with us. I think we're all missing Dave, and really glad that you could be here. Next week will be my 5-year anniversary for my initial diagnosis, and it was completely accidental. I had no symptoms whatsoever. I went to the doctor because I had discomfort in my abdomen, and it wasn't my doctor, it was a covering doctor, and she, for whatever reason, I have no idea, after about, 20 minutes, she said, I don't know, there's just something, I'm going to order a CAT scan. And she ordered an abdominal CAT scan, and they scanned my lungs. And they saw a pretty large tumor in my left upper lobe, and went through the whole, everything. The crazy thing was, the best way I can describe it, it was kind of like a hard-boiled egg, a small hard-boiled egg. It was huge. But they could never get cancer cells with the biopsy, and after going around and seeing everybody, everybody's opinion was, this is big, and it's growing, and you need to have it out. Doesn't matter if it's, benign. You just have to have it out. And so I had initially VAT surgery, which comparatively to the full pulmonectomy was not so bad. And when they did the full biopsy, it was just like the whole outside and wherever they did the frozen sections, they were all negative for cancer, but the yolk, inside the yolk, was cancer. So it was sort of a crazy thing. The whole thing is just kind of lucky, I guess, right? I had to go back, and I had the full left upper pulmonectomy, and because of the position, part of the left lower lobe is gone too. And then I've been fine. I've been coming here for a couple of years, at least 2.5, 3, I guess, and love everyone here. It's just wonderful, and the support and the friendships. And then last April, I had something, because again, obviously I'm under surveillance. I did not have any medication. I mean, they did the surgery, that was it. And then last April, they found a new growth in my right upper lobe. Not a metastasis, and again, genetically, you can tell all that, so, they were relieved. So the good news was it wasn't a metastasis, and that is good news. And I did have, they didn't want to take any more lung, per se, with surgery. So I had stereotactic radiation at the beginning of May. And I love the doctor, the radiation oncologist. He's going to come to the living room, I just found out, in May. And so put May on your calendar. He's really good. And he was wonderful. And he's actually now managing my care, at least for 2 years. And I just saw him pretty recently, and that tissue was all just a heap of everything. I did have one unusual thing that I'll share in case anybody else ever has this, because it was really about, not quite 2 months ago, about 6 months ago, I was awakened in the middle of the night with really bad pain in the area that was, where that had been radiated. And I didn't say anything for about 4 or 5 days to anyone. I was sure something really bad had happened. And I was just sort of dealing with it with myself, not very well. And I said, if I didn't know better, I'd say that one of the markers has floated away, and it's like jabbing me, And we went finally, and everybody, check it out. And nobody was very concerned about it, by the way, because it's not a big deal. But it's a big deal in your head. because it makes you crazy. Like, what is all this pain from? You know, it's like, oh my God. Anyway, it was the same radiation oncologist that decided he really wanted to find out what was causing my pain, because everybody else was like, oh, it doesn't matter. And it didn't matter, by the way, as it turns out, but it was a marker, and one of the markers is just floating around, and sometimes it gets in a place where it really hurts. But the only way to remove it is to go back into my lung, and that's, you know, I don't want to do that. It's not like today, some days I don't even know about it. Other days it hurts a little. And since I found out it's not cancer or something terrible, it hardly hurts, you know, it's okay. It doesn't hurt nearly as much. It doesn't hurt nearly as much.
We know what you mean.
But, you know, and I just guess I have to say it's always something. Right? And I feel very lucky and very glad to be here. And I just wish everybody happy holidays.
Thank you. With that biopsy of the original tumor, did they test it genetically?
They did.
Yeah.
They tested it genetically. EGFR, I don't know, you know, because they weren't, it was gone, right? So out, and it was stage 1. I mean, it hadn't gone anywhere else that we knew of. So I don't even know if they did I think they did do a full genetic mutation. I'm pretty sure they did.
Yeah.
I mean, we asked for it, but I never, you know, because they weren't going to treat anything.
Sure.
You know, I guess I don't know all the other things.
Okay.
Hopefully they still have the tissue if you'd ever need it, but it seems like at the moment it's okay.
Yeah.
Yeah.
Hi, I'm Marie, and I learned about this from Ina. And she had talked about it for I think you talked to me about it for a while, but I thought this was going to be like, you know, when you go to the blogs, oh my God, my life is over, this is horrible, da-da, and I'm just like, I worked in academics and medical schools and pharmaceutical, so it wasn't until Ina told me it was patient education, and there were academics and principal investigators coming by. I can't remember who it was, but there was a big PI from an academic institution. I'm like, what? Ooh, and that is how I finally came in. But Ina's got so much energy that you would never, ever know, even like through when you had the bout, like you couldn't keep track of her. I mean, if you put like one of those tile devices or Find My Friend, she's like all over the place, you know, traveling with family, with kids. She's nonstop and active in so many things. So for me, I think that I handled my diagnosis really well because I thought it was quite ironic that I'm a very strong but sickly person, and I have a walrus bark cough. And I've been asked to leave college classes. I worked at Genentech, and someone sent me a note half a floor away saying, if you're going to cough, go home. You're going to infect us. So when my cough started changing, people said something, but it was my normal. I think I would get sick anyway. So the ironic thing is that because I'm always, you know, I get sick in the winter, and it's a cough that lingers for 4 weeks, and it's really unfemininely loud, that when it changed, it didn't seem like a big deal. It didn't bother me at all. But I work at a pharmaceutical company, and one of the oncologists there, as well as my friends, said, you know, your cough sounds different. I'm like, oh, yeah, blah, blah, blah. And one of the doctors said, you should go and get it checked. And I'm like, well, they're just going to give me codeine. I already know the routine. So I did go, and, you know, it seems like I have a cold. So they gave me codeine. Well, you can't just take codeine for 4 weeks. I mean, you know, I have a whole lifetime of taking codeine. It's nauseating. It's horrible. So then he said, it's getting worse, go back again. And I just kind of wanted to ignore him. But one of my friends canceled a dinner date and said, we'll go to urgent care together. Oh, wait, no, wait, I went again. So the next time I went, it was to be treated for allergies. So I had a nebulizer treatment and, no, asthma, a nebulizer and inhaler. So then the doctor at the office said, how's it going? And I'm like, it's a waste of my time. It's making me cough more. And I hope this is helpful to people.
Mm-hmm.
Then he said, go back again. One of my girlfriends found out, and she said, instead of dinner, we're going to urgent care. Now I'm annoyed at everybody. So I go to urgent care at PAMF at Palo Alto, and that's it. That's when I knew as soon as, and I recorded my cough just in case it didn't happen. And it just happened. I had a good, blowout cough. She's like, why don't we do chest X? Why don't we have you do an X-ray? I'm like, oh, I don't know how to do that. What do you do? I've already arranged it. Oh, well, okay. She goes, come back afterwards. I come back afterwards. She goes, let's do a scan. I'm like, oh, a scan? Do I have to miss work? She goes, nope, I've already got it taken care of. I'm like, this is really good and bad at the same time. I think I knew then that, there was going to be a problem, but it was really pretty quick. I mean, PAMF they were on it. I mean, they don't resist testing. They'll get you tested. I had to go to see a pulmonologist still. There was a little bit of a delay in seeing a pulmonologist. If I would have done it better, I would have put two of them together rather than space them out and had it escalated with the urgent care doctor. The other thing I would recommend for people is for the cost of an X-ray, I would have gladly paid out of pocket. You don't have to go to PAMF. You don't have to use your insurance. There are imaging companies. For $400, I could have had a chest X-ray. I think it took about 3 months to get diagnosed, see the pulmonologist, get the interventional radiologist, who I had a great person. They recommended Dr. Colochi at PAMF, who I saw, and I have to say that whole thing was met with palliative care because of my staging. So they really had it on
stage.
Yeah, stage 4. And when I got tested, it was disappointing in that I didn't have any good mutations. So in listening, I hear a lot of people have the EGFR. So it's the EGFR, the ROS1, the ALK. PD-L1 positive is a great one to have now. What's the other one?
NTRK, RET.
Yeah. Okay.
BRAF. There's a few.
BRAF. So I came back and I got nothing. I'm like, oh, just my luck. Okay, so I've got nothing. So I'm thinking I'm under standard of care. So carboplatin, Litma, and one of my managers at the office, not an oncologist, but in clinical operations, had just read about Keytruda being approved for PD-L1 low. So they decided to try PD-L1 low, and I went to my oncologist. She'd just been, I think, out of the country. And a friend of mine from the office came with, and we went there with the FDA-approved article for PD-L1 low. And got it added on. Getting it through insurance takes some time, but I have a company that I work for that provides a case manager. So it's Abbey Blue Cross Blue Shield, and they provide a case manager. And boy, if you can get something like that at work, it is amazing, because insurance denied it. PAMF didn't know how to handle it, and so they dropped the ball a couple times because it was just newly, like within 3 months, approved for PD-L1 low. So you can't expect people in the back room to know how to get an approval for something that's just new. They're going to be like, this is too risky. So you go to a case manager that's there to help you, an advocate, and she pushed it through when they didn't do it, because I started getting bills for $90,000 for Keytruda. And I was now at a panic stage, as was PAMF, because they were on the hook for it. So again, if you can get that kind of service, I'd highly recommend it. They are an advocate that will help you get it done. So Bonnie had told me, I came here and I was always coughing, and she's like, you've got to get that cough fixed. The treatment, the carboplatin, the Litma, and the Keytruda were 6 cycles. Then they took off the carboplatin, and it was a breeze. I think when you don't have any mutations, they just don't want to kill you. They want to keep you, alive with quality of life. It's very different than breast cancer, where they think they might cure you, and you see horrible, you're really suffering when you go through some of the treatments. But you expect to be in remission. And here, I think my life was pretty nice because, I was healthy already, and the treatments were pretty benign. The only thing that was surprising, I think, to my oncologist, I hope, and to me, was that I was doing so well that I never expected to progress within under a year. And first it was my kidneys, so they took off the alitma, and it says to give my kidneys a rest. And then they took off, my oncologist took me off Keytruda. So now I'm not on treatment for 2 months. Then I'm on nothing for another month or 2 months. And they said, well, can we get, my kidneys, are they better? Can we get back on? She goes, your treatment's actually not working. So I'm like, oh, I wish I would have known that just a little bit earlier. And it also, so I think that's an uncomfortable time. It's kind of nice to get a break, but not good when you know now you're progressing and you're not on any treatment. And when you don't have a mutation, they don't know what exactly to treat you with. So the fascinating thing is, then I got a bone met. That's another lesson learned. Bone mets are so common, and I was worried about a brain met. So I would suggest also maybe having a full body scan of your bones. It would have been easier to be proactive. Insurance would have appreciated it. I would have appreciated it if I had something as a baseline. So instead, when I had this thing that was like, I don't exercise very much, but when it happened, it was like maybe you pull a muscle. And I remember Googling, what does a bone met feel like? I have no idea. And well, now I know it's like a little uncomfortable, glitchy thing. I have mine in my femur. So they found it was 2 inches. So then now you've got to have scans, radiation, and everything else. So that would be what I would tell other people, which is once they start pulling, you don't have a good mutation, they're taking treatments away, kind of insist on a scan. It's cheaper for insurance, and you don't have something that you have to worry about. So I actually had radiation with Dr. Dan Schiffner at PAMP. He's great. And he thought I was going to be walking after my treatment. I think I only had like 8. It didn't work really well. So I was on crutches. I couldn't walk. I got an electric scooter for work because I'm still working full time. And I had ergonomic crutches, so I proactively prepared for the worst. And then I got a rollator. So I have like all this equipment for when I start going downhill, getting rid of everything, just plan. And I think it got better with time, but I think it was like 3 months, Ina? About 3 months. 3 months. And I just couldn't get up and started walking. So it wasn't catastrophic. If things happen slowly, you just adjust like a little animal. You just keep going. So I just wanted to share that part. The other thing is, when you don't have a good mutation, don't stop there. Because what I found was the treatment that I was going to be offered was Taxo and a Tarceva derivative. And I talked with someone, our company was working on a drug for lung cancer for smokers. So I'm with people that are doing lung cancer all the time. And I'd mentioned this to one of the oncologists, and he goes, I don't know. I don't think that's going to work for you, and it's you won't feel good. It'll be miserable, and it's likely not to work. I think it works for like 10% of the population. And then I went to my oncologist and said, is this drug going to work for me? And she said, well, about 50%. I'm like, oh, well, someone at the office said 8%. She goes, well, I'm optimistic. Okay, so it's like 30 to 40%. So again, I think the thing to ask also is, what does this mean to me? Not like I'm desperate, because I'm not desperate. I don't want to suffer. So my decision making is going to be different maybe than someone that has a family and children and husband. But to find out what percentage of the population does it work for? What are the side effects? Are you willing to take them? Can you tolerate them? If I'm healthy, I could tolerate them, but if it's really a bad treatment, what if something comes up? Will I be in a state to be able to take another treatment? It turns out that this was happening in October, so I progressed in a year. They had done the Foundation One Medicine complete panel, but I didn't get it. It was done in April, and on it said I had the RET fusion. So the RET fusion, about, I think, what, 2% of the population has. It's also thyroid cancer. And my dumb luck, they've got 2 drugs for it, and it works. So the thing I press again is, if you have no good mutation, then talk to your oncologist to make sure that you go over that foundation medicine. I did ask for the complete panel, the expanded panel, and I think because I was so healthy, she's like, let's wait to progress. Lung cancer is just growing exponentially on treatments. But if you don't have anything, I think maybe I would have done it differently, and maybe you could have gotten in a clinical trial, because there were 2 clinical trials going on for RET mutations. One is the LOXO 292, which is started in 2018. They were published, they discussed things, I think, at ASCO in 2018. And then there's Blue 667, which was presented at the World Lung Conference this year, both for RET fusion positive people. So it's a minority of people, but within 1 week of taking the drug, my coughing subsided. I can walk. I've had 2 to 3 millimeter shrinkage of my tumor. The ground glass in the lungs has gotten better. And it's so funny because now I've got all this equipment for when I decline, and it's not happening quite yet. And so I know I'll use it later on, but not quite yet. So again, I hope those like little learnings across the way, like, you know, if you have a friend, you know, pay out of pocket and get a chest x-ray. You know, suggest that you want a full bone met, you want a scan to see how your bones are, to make sure you don't have bone mets or brain mets. Ask if you don't have a good mutation, ask for a full Foundation 1 medicine panel rather than just waiting. And then be active, like how did I find out about clinical trials? Because the oncologist at the office told me about them. And I don't know what people are doing that don't have good insurance. They don't have oncologists at the office helping them, and great doctors over at PAM. But now I'm over at UCSF with Dr. McCoach in the LOXO 292 study, expanded access program. It is great. Not only that, it is fun. It's pills. You go in for more testing, so you're monitored. The clinical trial process, when you're going into expanded, it's safe. I don't want to be a first in human, but this one has been showing that it's doing really well. So if anybody out there has RET mutation, you are just in dumb luck that they finally have some options for people like us. Thank you for all that time.
No, thank you.
Thanks, Marie. So I just want to touch on a couple of things. One, thank you so much for all of your what I would recommend, because so much learning happens from one person sort of going through this, you know, to the other. So thank you for that. 2, you brought up something that I think was really important, and we've touched on at different living rooms from time to time. We actually talked about it during one of the meetings we had earlier today, and it was whether you knew you were doing it or not, but this sort of shared decision making. You were talking about what you want your sort of process to look like might be different than someone else, but to be able to have that conversation and what are your goals of care, right? And to have a care team that will have that conversation back with you is wildly important. And then the other thing that you brought up early in your story was that you were put together with a palliative care team. And I know when most people hear the words palliative care, they go into panic mode because they're confusing it with hospice care, when really it's just supportive care for whatever, you know, place you might be in this. I don't want to call it a journey because but you know what I'm saying, right? And so how did you feel about the palliative care team, and how did that maybe help you?
Loved it.
Okay.
I worked over at UCSF in hematology oncology as a fellowship and CME coordinator. And so I actually put on a CME conference for palliative care. And so I learned about it from the doctors that were working on it. And so I had a very positive impression of it. So I was really impressed with, I had my diagnosis, and Dr. Colochi put in an order to meet with palliative care. It was terrific because you just are mentally kind of have someone to talk to. For me, it was, how am I going to tell my family? I think that was more of a stumbling block. The other stuff I could manage pretty well. but it was just a relaxed conversation. I converted to Judaism, and I happen to have a doctor that is Jewish, so you could talk about, your values, end of life, what is important to you, to me, and it would be for whatever it is. What is your quality of life? I think I was like, but I don't understand. How am I going to die? Like, what is it like to die from lung cancer? And he goes, well, we can talk about that later, but. I've looked at your medical records. We discussed a little bit. So he gave me a little bit of an idea of what my life is like now, if the treatment's successful. And for me, I think I was kind of focused on, okay, how do I prepare for the end? And I thought he was so good. I met with him again when I had progression. And I would meet with him again because I trust him. And I think it's a natural conversation if you get in the habit of thinking that that's another ally. It's another person to help you and your family. And for me, my goal is to do the best that I can based on what medicine has, based on what people are discovering, but to make sure that my family is comfortable when I'm no longer here. That is like my most important goal, and then my friends. So having a quality of life, not suffering, and then to make sure that my family has positive memories, and how can I help them? And that's what I needed palliative care for.
And I think
it'll change, I'm sure.
Of course, but I think it's so huge because a lot of people don't talk about the very things you're talking about right now, which is why I think your story is so important because, you're born, right? The only two certainties in life are birth and death, right? If you're born, you're going to die. The only certainties. Everything else is a mix of a lot of different things, right? And there are classes to take on all of these different things, and people talk about all of these different things that affect you in life, but nobody talks about dying, and we're all going to do it. So thank you for sharing that, because I think it's really important, not even for somebody who's living with, a diagnosis of lung cancer, but for anybody. Yeah. So thank you for sharing that.
Really quickly, just one other point. You'd asked the question somewhat rhetorically, I think, about, I don't know what people would do if they didn't have an oncologist in the office. I'm just going to answer it and say, call us. That's what we're here for. We are glad to help answer those questions and do our best to provide that knowledge and share information. So please just call. That's what we're here for. Yeah.
Is he flashing the 800?
I was thinking that would flash over my head, and it would sound like it would look like a
waiting.
Yeah, we're just waiting. He'll get there. We're good.
I think it's worth David mentioning too. Again, reminding people about Lung Match, and that's our kind of
Amy.
Yeah, you need a mic. Sorry.
I see that. Remind people about Lung Match, and that's where we do have dedicated staff to help you with those treatment trials decisions and try to help you be prepared and empowered to go into your appointments with information and available options for you. So take advantage of it.
Yeah, and you talked a little bit about going back to get the foundation testing, and whether it's Foundation or Caris or whoever might be providing that comprehensive testing. It's also an important discussion to have with your physician. We just had our Care Continuum Center of Excellence conference in Nashville last week. It feels like it was last year already.
I'm with you.
I think it was last week. But we spent an entire day talking about sort of the state of what we're calling biomarker testing in this country, and precision medicine that is attached to it, and some of the barriers and the challenges to getting appropriate testing for patients up front and then at progression. And so it's great to have your stories to be able to use to go back to kind of, to absolutely prove the point about why it's so important. So, yeah. Rick.
Hi, I'm Rick Bryson. I was diagnosed in February of 2015 with stage 4 adenocarcinoma. I went in for another ailment in the end of January, and through some of those tests, ended up getting a chest X-ray that turned out to be a tumor in my upper right lung. And so I was a never smoker. I didn't have any symptoms really. And I'm being treated at Kaiser Santa Clara. But I was able to get, since I was stage 4, they put me on with a palliative care team as well. And they worked you know, very hard at quality of life issues, pain management, symptom management kind of stuff. So you had a second opinion right there. You didn't have to just deal with, trust your oncologist, which was really helpful. Kaiser only tested for the handful of genetic mutations at first, and I had none. So I got to go into the old-fashioned chemotherapy. So I had 4 cycles of carboplatin, Alimta, and that was it because they didn't have Keytruda available at that time. And then I was on Alimta only for maintenance. After 8 months, I had progression in my adrenal gland, but the carboplatin had shrunk my lymph nodes and my lung tumor to a point that I was considered a surgical patient, so they were able to remove my adrenal gland. And from that sample, we did a Foundation 1 genetic profile. And that gave me peace of mind just because it just reaffirmed that what my oncologist at Kaiser was the path they had me on. So that was really helpful. And after surgery, I was on Taxotere for a few months. But in February of 2016, I had my first clean scan, and I've had 3.5 years of clean scans since then. So it's been 4.5 years since diagnosis, and doing pretty well. I opted to retire in the middle of it all because it was pretty chaotic with all the scheduling and such. So I fill my days with volunteering now and taking the dog on 3 walks a day and spending time with my wife and my adult kids. We go visit them on vacations. One complication I did have a year after chemo stopped in 2017, I ended up having a blood clot in my thigh that had, been growing for a while because it was from my knee up into my groin. Wow. And so I got that taken care of at Kaiser Redwood City, and then I got put on a blood thinner, Pradaxa, that I'll be taking forever. But I want to wish everyone a happy holiday. I've been coming here since summer of 2015, so this has been really informative and helpful information that I get here. And I'm also in a couple other support groups as well. One's at Stanford that Tina introduced us to. But being in support groups has been, helpful, being able to share with others tips and tricks and pulling a nugget out of how we can cope. So thanks. Have a good holiday.
So Rick, sorry, Katerina, so you touched on something that I was going to kind of wait till the end, but since you brought it up, I'd kind of just like to ask the group now, because we hear quite often that people aren't comfortable with a support group. I think we talk about stigma with lung cancer and other things, but I think there's sort of a stigma when it comes to even support groups as well. So what are you doing?
Are you going to get up and dance?
So if there was anything like what you would recommend just to kind of go along with that sort of theme, or what you would tell someone who's newly diagnosed or at a transition sort of period within their diagnosis about this group and others, what would you say? Because I feel like that's one of my struggles, is trying to get people to really understand what you all get out of it.
Well, you really understand when you talk to other patients who are going through similar situations and treatment options. because the nurses know a lot, but the patients know how to deal with it day to day, hour to hour.
Yeah, Larry. And this is an open question to the group, too. Yeah, Francis, we'll get you a mic.
I think the best thing to tell people is watch the living room.
Yeah.
And you'll find out why you want to be here.
Yeah. Thanks, Larry. There we go. Francis in the back.
Yeah, I think it's vital that when you, for the first time, walk into a support group, it's an anxious time. Do not be ashamed of your lung cancer. That's critical. Because the moment you're ashamed, you kind of you fumble around, you're shy and all that. But no, it's important. It's people who are in the support groups, they want to support. That's why they're there. So if you're a newbie, just walk in there and don't be ashamed.
Thanks, Francis.
I'm going to go back to one other point, if it's okay.
Sure.
Unless anybody had comments about the support group before I move on. Rick, you'd also mentioned with your testing, it was peace of mind to know that the doctor had you on the right path because it reaffirmed your initial testing. And so when we talk about testing, it's not just maybe finding out what's there, it's finding out what's not, because that also influences your treatment greatly. So I'm glad you shared that that was still something that you were glad to know in terms of making sure you were on the right path. But when we talk about something like immunotherapy, until they've ruled out some type of genetic marker that has a targeted therapy, they can't put you on to, or at least they're not supposed to, with immunotherapy until they rule those out. So it's very important not just to have it as a test that affirms it, or confirms, but it's something that can rule out other options. So thanks for sharing that piece of it as well. It's very important.
Yeah, absolutely.
Yeah.
Hello, my name is Katerina. I'm actually a caregiver. My mom is not here today. But to sort of touch upon this idea of support groups and coming here. So my mom was diagnosed a little bit over a year ago in November. And the day that she was having her biopsy, I was babysitting and got a message from my friend who told me she had heard about what was then the Dairy Foundation. And my sister, who was at the hospital with my mom, got a message from her friend. Her friend is a big supporter of Go2 Foundation, and we both found out at the same time to come here. I think she met with you, my sister, that day and got the book. And I told your mom, Bonnie, a couple of days ago that I stared at her picture on the book for a month until the living room. And I actually came here and I met Kim. I don't know what happened to Kim, but I was like, the other Kim.
Oh, the other Kim.
Shapoister.
She was getting more wine for people, I think. Yeah.
I came by, I kind of surreptitiously came by, I think, a couple weeks after, and I was like, can I just come see this living room, this space? Because I cannot wait for the first one, which was exactly a year ago. My first one was last December.
Wow.
And I remember walking in here and it was empty, but I just felt the energy of the room. And I was like, I need this. So that was my sort of mentality regarding the support group. Another thing I want to say is for the people out there that whether you're a patient or a caregiver, and if you're new to this and you're lost, believe me, I was lost during that first living room. I think I cried during the whole thing. I remember I messaged my friend who's very savvy with medical stuff. I was like, I will never understand what anyone in this room is saying. I was completely overwhelmed. And I have to say, most of what I've learned has been through osmosis, is just listening to the living rooms, going back to old ones. I was like, there's no way. I will never understand one word these people are saying, and it's completely not true. So just be patient with yourself. Get the book from Go2. Watch the old living rooms, and you'll definitely feel comfortable at some point. So on to my mom. She didn't have any symptoms like many people here. But thankfully, she was diagnosed pretty quick. What happened was she was babysitting my niece who developed croup. And then she developed a cough, and we all thought she picked up something from my niece. So she went to the doctor. Her doctor wasn't available, so she saw someone else who I feel, this seems to be rare, was very, very intuitive and just said, I don't like how your cough sounds. Let's do a X-ray. I think an X-ray and then a scan. So within a week, we knew. It was stage 4, non-small cell lung cancer, adenocarcinoma. I didn't know how to even pronounce this word last year. She's a never smoker, had just turned 61, so pretty young. She had never been sick, no family history of cancer. I mean, it just came out of nowhere. Her PD-L1 expression is low, 5%, and also no mutations. She's done all the tests. The 2 little mutations they found on the Foundation 1 testing, they're not anything that anyone knows what to do with. So she started her treatment her first line of treatment, for everyone who doesn't know that, that's the first round of what you do. Last year I was like, what are y'all talking about? She did what you did to carboplatin, Alimta, and Keytruda. She did 4 rounds of that. Her scan was stable, so because it wasn't shrinking, they felt not to do the full 6 rounds of carboplatin. So then she was on maintenance, Alimta and Keytruda for 4 rounds, and she had progression. So we did another round while we were figuring out what next. And she started a clinical trial in July with Nectar. So it's Opdivo, which is an immunotherapy, and then another drug, which is an immune therapy type drug. She's felt fantastic on that. She'll just have about 5 days of flu-like symptoms, and then she feels back to normal. While on the chemo-immunotherapy combination, she wasn't doing so great. So we were hoping that we can just stay on this, or it's become we in our family. She can stay on this indefinitely, but though the targeted lesions that they're following, the lung mass and the pleural nodules, are stable, a lymph node has been acting like a little jerk and has tripled in size. So we're in the process of figuring out the next step. That's been going on for a good 6 weeks now. We talked to the phase 1 clinical trial department at Stanford and also at UCSF. So also that's something I learned for people that don't know. You can have clinical trials within your oncology group, but then also there's a different department that you can speak to. So there's too much detail to go into all that. I don't know what we're going to do next. But yeah, I guess I just want to say for especially the new people, hang in there. It does get easier. I'm proof. So that's all.
Thanks, Karen. You just spit out a bunch of really big words, and
I know,
right?
Yeah, not the same experience by any means, but I started in the lung cancer space about 11 years ago, and my first week on the job was one of the largest oncology conferences in the world, ASCO, the American Society of Clinical Oncology. Truly, I'd worked in the cancer space, but not on the science side of it all, and they sent me to this meeting and said, go learn. And I remember calling my wife after the first session. I said, I am clearly the dumbest person in this entire room, and I think that's probably a really, really good thing. But you learn, you do. It's osmosis in some cases, and doing the reading and doing all of that, and you become educated over time, certainly.
Can I add one more thing? So this, I don't remember if it was Amy or you or someone brought up when we were looking at different genetic testing, because we've done a bunch of second opinions, and there's one doctor who likes to do a lot of testing, and he was suggesting RNA sequencing and all this stuff. And I was like, I don't understand any of this. So Amy put me in touch with Andrew, who, I don't know what what does that mean?
His last name?
No, I mean his role.
His manager,
clinical research, yeah. So he's in DC. So that's, I think, the benefit of the merger, right? Is that all of those services are now available to all of us. And he spent a good hour with me on the phone and was fantastic. He just walked me through everything because I'm trying to have an informed conversation with an oncologist and felt like I didn't know what I was talking about. So after that conversation with him, and it was free, and that's what GoTo offers. So
As much as oncologists try, I think some of them still struggle with bringing things down to a lay level. Part of it is because every day they're in a space where they're talking about it, and it just becomes shorthand and secondhand, and it becomes difficult then to bring it back down to someone who's just learning. And so that's where our team and Andrew and the others can really play a role, is to have that conversation with you and say, when they're talking about these things, here's what they're talking about. Here's what it means. I was the interpreter for my brother, who 2 years ago was diagnosed with kidney cancer, and the doctor would say something, he'd look at me, and then I'd interpret it, and then the doctor would say something, he'd look at me, and I'd interpret it. And at a certain point, the doctor's like, do you just want to take over here and explain it? Because he recognized it was a struggle. So having that resource to talk to someone and just say, I've made some notes, here's what they're talking about. What are they? What does it mean? Because you may not feel comfortable asking at the time, or you may not have been able to grasp what was coming in. So we've told people before, record it if you need to, take copious notes if you need to, ask for these things in writing if you need to, take as much information away from these appointments, and then know there's resources that can sift through it with you and really give you that better understanding. It's so important. Yeah. Agreed. Get the mic. Oh, and bring a friend. Bring a friend. Absolutely. Bring someone with you. Yep.
Bring a friend. Thanks, Marie.
Yeah.
I'm going to go over to Michelle and Amy and see if anybody online wants to say hello or anything.
Lots of folks on Facebook Facebook who say hi. So all of our friends are there. I did send a shout out to Dawn and Tim. We miss having them in the room. You know, people are sharing their stories, and you know, there's similar experiences of misdiagnoses, and so yeah, I think it's helpful, and they appreciate having this forum just to learn from and share with all of you. So thank you to everyone.
Thanks, Amy. And for those of you who haven't gone, I mean, I'm sure some of you have gone back and watched, living rooms that you weren't able to attend live, but you can go back on Facebook and actually see what comments folks who are watching have made. And if you feel like you have something to add, that's certainly a space where you can go back and add sort of your input to the folks who are chatting online. So thank you. I think we're gonna have to pass this mic.
Oh,
is there one there?
Great.
Okay.
Awesome.
Hi, my name is Teresa, and so I was diagnosed on June 5th, 2017, and the year before that I had been coughing, tremendously coughing day and night. I remember my children would say they could hear me when I parked the car coming home from work. They could hear me coughing while I was still in the car until I came up. I was coughing up a lot of phlegm. It looked like an egg yolk sized color and raw egg yolk. And then some blood. And I don't know why I didn't see the doctor earlier. And so my kids and my coworkers insisted I saw a doctor. He thought I had allergies. And when I was visiting him, I wasn't coughing. He listened to my lungs. He didn't hear anything. And so I was on Claritin for a year, and then I came back after around 6 months, and I said, I'm still coughing terribly. And so he says, I think you have GERD. So I was on GERD medicine. And then I was at work, and one of my coworkers, they grabbed the phone, they found a doctor, you call this doctor now. So I did, and my children too, they insisted. I changed doctors. I told her, she saw me, I wasn't coughing when I was at my appointment. She listened to my lungs, it sounded fine. But I told her I just recently started to lose weight. And suddenly, and I've been exercising for years and I never lost a pound, and suddenly I lost close to 10, 15 pounds in a short period of time. And she said that's what made her stop and listen. She sent me to get an x-ray right away. The next day she called me at work and she said, do you want to come in or do you want me to tell you over the phone? And I said, you can tell me over the phone. And she says, they found a huge mass in your right lung. I had no idea what that meant. And I asked her, how worried should I be? And she said, it's huge. You have to come in right away to get a CT scan. It was 16 centimeters when they got the CT scan.
Bigger than your lung.
And so I went through a lot. I met a first oncologist, and he said, I never knew this existed. I'm Japanese American, and he said there's something called a Japanese women cancer. I guess that's EGFR, and so that's what he thought I had. And then somehow I was luckily able to get into UCSF, and I had brought the CT scans, and I was able to see Dr. Jablins, who is also your mom's surgeon. And he came in after looking at the CT scan, and he goes, "You got a monster in there."
That sounds like David.
That does sound like David.
Yeah.
And so, and he reassured. My daughter was always with me at the beginning, all of the beginning appointments, and he laughed, made us laugh, and reassured us. And so there begins the world of lung cancer, which for most of it, all of us, we have no reason to think about it, and so we don't know anything about it. And that's when the worry, I guess, starts in, because you just don't know what's ahead. I was fortunate, and I was able, my oncologist is Dr. Blakely, and so I was able to get testing, Foundation 1, and Guardant blood testing, so I had a needle biopsy. And so I have met exon 14 skipping. And then they decided to not put me on chemotherapy, but to start me right away on crizotinib, Xalkori. Yeah. I had a fantastic result, so it shrunk from 16 centimeters to 9 centimeters in 3 months.
My company, that's working.
And no chemo. they were able to do surgery. So I had it in my mediastinal lymph nodes and most of my right lung. So they took out the whole lung and all the lymph nodes on the right side. They tested it right after the surgery, and they showed no viable cancer cells in the tumor, residual tumor. And they'd never seen that. So Dr. Roto, Julia Roto, who's a fantastic doctor as well, wrote an article about it. And they had not seen it because I had no chemo or no other treatment but the crizotinib. So I was very lucky. And then I was NED for several months, but I stopped the crizotinib. And I met one of the patient advocates here for ROS1. I forgot her name.
Janet Freeman-Daly?
Yes. Yes, Janet Freeman-Daly. And I spoke to her after the meeting here, and she said, and she has ROS1, and she said, if you stop crizotinib, it'll come back. So that stuck in my head. If I stop crizotinib, okay. So I mentioned that to my doctor, and he said, well, your case is different, which is true. And so we decided to go off of it. And then, sure enough, 3 months later, they discovered some small nodules, but fortunately on the same side, so it wasn't metastasis, it was just residual nodules. So I went back on crizotinib, and I went and had the TrueBeam linear accelerator type of radiation. And so I just had that in October, and I've been back on the crizotinib, and my last scan, which was last week, shows that it's shrinking, so that's a good sign. And so I've actually only missed 3.5 weeks of work after the pneumonectomy surgery, and have been working since, and I actually feel pretty good. I've been able to handle the side effects of the crizotinib, which is more bothersome than anything else. And but for the people that are just learning, I have a coworker who just last week found out she has breast cancer, and she's a very strong woman. She has 2 small children, and she goes, "No, I'm doing fine. I'm doing fine." But I told her, "No, please come talk to me." I told her, that please look for, and I told her all about the lung cancer, even though she has breast cancer, but I told her there are support groups out there, and they're so helpful because you don't know anything and you have questions. So find one. And I told her that I think it was the hardest part is the beginning, because you're just slapped in the face with something that you never would think about. And you have questions, but you don't know what's coming. You don't know what questions to ask, right? You just don't know what's going to happen. And so that period of waiting, not knowing, and learning. And so I looked on YouTube, actually, and I watched the Lung Cancer Living Room and other things on YouTube, and it was very helpful. And so I think the more that you learn, for me in any case, I studied molecular biology, and I don't know if that helped or not, but for me, the more I learn, the better. Some people are told, don't go online and don't look it up. And for some people, that's better. But for me, the more I could find, the better I felt. But anyways, happy holidays to everyone. This group is fantastic. And sometimes I can't come because I missed the last 2 months when I had a bad cold, and the other I went on a short trip. And that's the other thing. I went to New York the day after the 5th day of my radiation treatment. And I don't recommend to anyone flying or going anywhere unless you're resting after radiation treatment, which, wasn't so bad, but the flight to New York was really bad for me. And it could have been a combination of things. But anyways, I'm glad to be here, and I'm glad to see everyone, and happy holidays to everyone.
Thanks, Teresa.
Hi, my name's Robert. I'm here with my wife and caretaker, Joanne, or caregiver, I guess I should say. I was diagnosed with stage 4 in May of 2014. I've had the typical, it sounds like to me, typical lung cancer experience with radiation and chemo and this and that. Yeah. Microwave ablation, cryogenic ablation, feels things like that. But last month I got a NED on my skin, so pretty happy with that.
Thanks, Robert.
Hi,
Jane.
Like hearing that.
So when you first got diagnosed, he said, I'm going to give you 4 years. And now it's 5.5. And we just celebrated our 74th wedding. I mean, our 54th wedding.
See, you're just thinking ahead, too. See, that's a good thing. You're thinking ahead.
My name is Jane, and I was diagnosed. Well, I fell in 2012 on my front step on a rainy night and had been feeling great, but broke a couple ribs. And in the x-ray, it showed a spot on my lung. And so my internist suggested we wait 6 weeks and see if it had just been part of the damage of the fall. And it didn't shrink in that time, so I had a CT scan. And it also, as someone else said, was just too big not to pay attention to, although it wasn't clear that it was going to be malignant. So I was lucky enough to have surgery, but I didn't know when I went into the surgery whether it was malignant or not. I did know when I came out of the surgery and saw that it had been 5 hours since I went in instead of 1. That was what my doctor had said I would, the difference would be. So they thought that the cut was the cure. And then 2 days later, when the pathology report came back, they found that there were 8 lymph nodes in that lower third of my right lung, and 4 of them were malignant. So I had to go through chemo, and I was EGFR positive, but I was just maybe a month or 2 before Tarceva would have been the line to go. So I had cisplatin and Alimta, and I was very sick from it, like lost 13 pounds, and that was not okay. And I just could hardly keep a teaspoon of water down. So my oncologist switched me to carboplatin and Alimta, which was no picnic, but it was a little bit better than cisplatin. So I went through 4 rounds of that, and since then my scans have been NED. So I feel lucky in a way that was the case. I'm now in a kind of an interesting position that this is the perfect people to talk about. My oncologist at PAMF has said I'm now 6 years with good scans, and so she has kind of dismissed me and basically said, let me know if anything comes up. I'm always available. I'm always this. And I'm thinking that I don't want to be dismissed. I don't want to, I don't know, I don't want to wait for a symptom or something. And I just wondered what the standard of care today is. I know that the standard of care before was kind of don't look for trouble and there'll be symptoms and it will avail itself if it metastasizes. But that's not what today's feeling is for me.
So Jane, there's no plan for like annual CTs or anything?
No.
Which isn't uncommon after 5 years of NED for a lot of places. That's the standard of care, is to go 5 years, clean scans. They're assuming that it's cured, and they will stop scans. That's policy at a lot of places.
Sure, but you would think, and this just me.
Oh, we would think.
Thinking out loud that nothing like a cancer diagnosis 6 years ago or not to qualify you for screening.
You think?
So you would think that you'd at minimum be able to qualify for low-dose CT on an annual basis. So that is definitely something you might, and maybe it's not your medical oncologist, maybe it's a pulmonologist that you go back and talk to about that. And P.S., all of you should have a pulmonologist that you're seeing on the regular. If you're not, it's something that we can discuss, but the disease that you have been diagnosed with affects your lungs, and pulmonologists do lungs. So for everything outside of the cancer that might be affecting your lungs, whether it's a comorbidity like an emphysema or COPD, or if you've had a pneumonectomy or a lobectomy and you have not had altitude function tests and you're flying to New York, you should really, really have a pulmonologist on board who's able to kind of watch over that sort of thing. So let's chat, because I don't know that, to David's point, post 5 years, technically, if something were to creep up again, it would not necessarily be considered a recurrence, but a second primary, right? By the way that they look at these things. But that doesn't mean that there can't be a conversation with a physician about it.
I'm also wondering if there's any trials that you could get into that are going to use liquid biopsy potentially to monitor as well. That might be an option.
Yeah.
And I am.
Okay.
I am. Now, I signed up for Natera, which has now become commercial, so it's no longer a trial. But, you know, my oncologist is a general oncologist, not a lung cancer specialist. And I'm feeling like I would rather have someone like that.
Yeah, worth that conversation for sure.
Yeah,
Okay.
let's chat about it.
Yep.
Awesome. Yep. Okay. And thank you to everybody here. Have a wonderful holiday. And oops, Barb's not there. But okay, I just want to say that going to Dave's celebration of life, I came away feeling as though there were so many reminders of how to live your life. So I want to thank Barb, and I will thank her when she returns.
Thanks, Jane.
Thank you, everybody.
Yeah, I just want to say, like so many other people here, my cancer was detected because of back pain. Those symptoms that you would typically, relate.
Yeah.
Back pain. Yeah, I was gonna have a epidural, and they wanted to do an MRI so they see where to put it. Okay, I was gonna have an epidural done because of back pain, and they did an MRI so they could see where to place it, and that's how they found the lung cancer.
And they called him on his 70th birthday. They called that he had cancer on the phone. That was horrible. That was pretty sad. You don't tell somebody on the phone. It was horrible.
Karen.
Hi, my name is Karen. I am just about a 12-year survivor now. My cancer was a total accidental finding. I had a lot of stomach aches, and we thought I had gallbladder problems. And my doctor went right to a CT scan, no X-rays, and the technician that did the CT scan saw the spot on my lung. And things moved very, very quickly. I went from my primary care to a pulmonologist who immediately ordered a PET scan. That happened, I think, like within a week. And he said, after the PET scan, he said, well, I'm sure this is lung cancer. If it isn't lung cancer, I would be very shocked. So he said, I want you to go to UCSF. And I went to UCSF, and Pierre Theodore was my surgeon. He said, we're going to do surgery. We're very confident of what this is. You don't even need a biopsy. So I had the upper left lobe removed in January 2008, and it was a non-small cell adenocarcinoma. And at the time, there was no discussion of any markers or anything. And just in the last 2 years, I was digging through some old files, and I found out that I do have an EGFR marker. But it was never talked about then because it was 12 years ago.
Yeah. No.
So after I went back 2 weeks after surgery, and we discussed whether I needed treatment. And he said, well, we staged you at a 1B. You could have treatment, or that's up to you. He said, but why don't you go talk to an oncologist? So I went to see Fred Marcus, who was just wonderful. He talked to us for 2.5 hours, the pros, the cons. And it's so funny. The one thing I remember from that meeting was he said, the great news for you is if you have a reoccurrence, there's a brand new drug out called Tarceva. If you need it, it's there for you. And so I did go through 4 cycles of carboplatin and gemcitabine, which nobody knows anything about these days. Nobody talks about it. It actually had some little weird side effects that caused neuropathy that I still have today and won't, it's not going to ever go away. But I've talked to quite a few doctors through the years who look at me like I'm crazy because very few people know about gemcitabine and this particular side effect. But I got through the treatment. Fred Marcus, as everybody knows, left practice and then passed away. And the doctor that took over his practice, and this is to Jane, I saw him for a couple of years, and at 5 years, he dismissed me. He said, you don't need me anymore. And I said, wait. And he said, well, you really don't you don't need me anymore. And he said, but you're seeing a pulmonologist. And I said, yes. And I immediately went to the pulmonologist, and he said, oh, no, we're not going to stop here. So I still, excuse me, have the annual low-dose CT scans, which I think I would be crazy in my mind if I didn't have the comfort of having that. But and here, this foundation is just phenomenal. If the whole world, if any lung cancer patient, any cancer patient, could see the inspiration and the spirit and the love in this foundation, they would just be so moved. I wish, you know, my constant hope is to just keep letting the world know that we're here, especially for lung cancer patients, but I hope that there's things like this for cancer patients of any type of cancer. But it's just amazing, and I always want to do what I can to help spread the word and be supportive. Thank you.
Thank you.
Thanks, Karen.
Hi, everybody. Is this on? Can you hear me?
It is. We can hear
you.
you.
Anyway,
Yeah.
my name's Evie Schiffman, and my story is a two-part story. It started in 2011 when my husband Neil was diagnosed with stage 4 adenocarcinoma, EGFR positive, and he went through the traditional treatment that everybody has talked about today. He was on Tarceva. He loved that drug. It made him, he was very, very athletic. He said that gave him more energy. He just loved that drug. And then that stopped working after about 10 months, and then he went into a clinical trial, and that bought him another 9, 10 months, and then went on to different types of chemo. He also had many, many cyberknife procedures and eventually needed whole brain radiation. He passed in 2015. And he loved coming here. We came here religiously from 2011 on, basically. And it certainly was a support group. But more than anything, I mean, for me, I'll go into part 2 of the story. This is as much for me about how I can learn more and also be giving back to everybody. Yes, I need the support, but I want to be able to give the support too, obviously. So flash forward, I stayed in touch with the foundation, very much involved, volunteering. And then in June of 2018, I was diagnosed with cancer, with lung cancer. And the absolute only reason I was diagnosed, it was accidental, incidental, is that I had read an op-ed in the Mercury News written by 3 doctors who talked about a scan to test the calcium buildup in the arteries going to your heart. And it was a test that would tell you if you were at risk for heart disease, stroke, or I can't remember what the other thing, but it had nothing to do with lung cancer. And so I read this article in February of 2018. In May of 2018, I went to my primary care doctor as part of my Medicare annual, and I said, what do you think about me having this test? It's good enough for the president and the pilots. Can I have it too? And he was great. He said, sure, I don't know if your insurance will pay for it, but sure. And lung cancer was the last thing on my mind. So I have the test, and the good news, I don't have any calcium buildup. My heart's in great shape. I'm not going to have, well, everything is relative, but I'm okay with there, and I'm okay on the stroke front, but you've got something in your lower left lobe. So, and he mentions crushed glass. Is it crushed or
ground?
Ground. I knew it was something like that. Same thing. But anyway, ground glass, and I knew this isn't going to be good. So immediately I'm on the phone with the foundation. And I have to say that I don't have any family locally, and obviously my husband was gone. And I was pretty informed about what to do, but I'm still like deer in the headlights because how can this be? And Michelle went with me to my first appointment, Dr. Wakerly, because that had been my husband's doctor. And then the next visit, Danielle went with me and helped me through all of that. And so at the end of the day, I was EGFR positive, just like Neil. And I had a surgery, which I know is good news when they tell you you can have surgery, because I was just stage 1. Removal of the lower left lobe. And this, so I'm a year and a half out. And I had a scan 2 weeks ago, and then we all know that kind of like that interim, like you got the scan, and then you don't see the doctor until like the week after, and they won't, you don't know what the results are. And I wasn't too nervous, I was like, okay. So I saw Dr. Wakely, and the scan is no evidence of disease, which is great news, and always a relief to hear that. So my advocacy work is about everything for this foundation because it's so wonderful, and about early detection, because the fact that I was stage 1, and let's face it, most people don't get diagnosed at stage 1 unless it's an accidental thing, because I had no symptoms whatsoever. So anyway, Happy New Year, happy holidays to everybody. And I will just say that Barb, and we've all mentioned Dave, and she has that wonderful badge that says, "We believe Dave made a difference." Not only do we believe it, we know that he did.
Amen.
Thanks, Evie.
My name is Fred Palmer, and the first thing I did after I was diagnosed with lung cancer in October of 2013 was to go to a meeting sponsored by Stanford University in Palo Alto, where they were discussing the latest treatments in lung cancer, because obviously at that point I had a very keen interest in finding out more about what I had. And sitting next to me was a man who had Bonnie's book in front of him, the famous book. Mm-hmm. It was Neil Schiffman, and he told me about this organization. So I called up, I called up what was then the Adario Lung Cancer Foundation, talked to Danielle. Went down there a few days later, and Danielle was fantastic. She spent about an hour with me, and she said, "This is what you have to do." She said, "Here are the best oncologists that deal in lung cancer in the Bay Area. Here's what you have to watch out for in terms of various mutations that you might have." She strongly recommended genomic testing. And of course, within a few days, I had a crash course in genomics, in learning all the alphabet soup of that. So that's how I got involved with this organization. It's been wonderful and very supportive. The next thing I did was I got a test for Foundation Medicine. And of course, at that point, they were only testing for about 3 different mutations, because as far as they were concerned, it made no difference if we knew what the mutation was if we can't treat it, which I think is a little absurd. So anyway, I found out through Foundation Medicine that I had the KRAS mutation, which at that time had no treatment. But it's proven very useful to have that information since, and I think it's very important. Things are happening so fast in the area of treating lung cancer that what may look to be irrelevant today, or or maybe not subject to treatment, might be very treatable in 6 months. So that was very useful. I want to say one thing about having genomic testing, and that is, if you don't worry about if you can pay for it, just do it. Because in most cases, as I found out, if you can't pay for it, they're not going to charge you for it. And I've seen people actually change their health care because they say, well, it doesn't cover genomic testing. Well, have it done anyway. I mean, I did, and it worked. The other thing I did was I found out through the social worker at Kaiser, where I'm being treated, that there's an organization in San Francisco called the Second Opinion. Anybody who has cancer can sign up for a tumor panel, free. And what they do is they take all your records, and you talk to specialists in the area of cancer. You talk to radiologists, you talk to oncologists, et cetera. And they give you practically a full day. You have a one-on-one with an oncologist, and then you have an interview with a panel, and you discuss things back and forth. And they also make a recording of the meeting. So when I had my meeting, I just at point blank said, well, how long do I have, given diagnosis? Well, they said a year to a year and a half. This is back in 2014. So obviously they weren't quite right. And the reason was because they couldn't foresee the treatments coming on the horizon. So I went through all of the usual things, the radiation, chemotherapy, and then I actually did some targeted therapy for a while. And when nothing seemed to work anymore, I went on immunotherapy, which I should have known I had a very good chance of responding to because of that KRAS mutation that everybody thought was so irrelevant, including the tumor board back in 2014. So it turns out that I'm 80% PD-L1 positive. And I was on Keytruda for about a year and a half, and I developed pancreatitis. It's very common with that because it's an autoimmune situation. And so I went off immunotherapy. I couldn't take it anymore. Meanwhile, I was being treated with a steroid to try to bring the pancreatitis under control so I could resume immunotherapy. And I had a test 3 months later, and there was, a spot that was showing up, but it looked like pseudo-progression. It was, it wasn't going anywhere. 6 months later, same situation. 9 months later, the same situation. A year later, the same situation. Year and 3 months later, the same situation. Nothing's really happening, and I'm not on any kind of treatment whatsoever. And I said, is this common? And he said, yes. Once the immune system gets stimulated, it tends to, take over, especially if you have a strong PD-L1 expression. So I've been off therapy for almost a year and a half now, and I'm very stable. So the other lesson is, besides get genomic testing, take advantage of the second opinion. So it's always very good, but also go after the latest treatments and try to stay one step ahead of what the cancer is finding resistance to. And it's like a game. You want to always stay one step ahead of the disease, and it really does work. So I really want to thank Danielle for all the support she's given me over the years, and great group of people. They've been very supportive. It just gets to be family after a while. And the other thing I want to say is this: if you if you listen to the cable channel in Palo Alto or Penn TV, there is a concert that I conducted on December 7th, holiday concert. I think it's one of our better ones. It'll be broadcast. Little plug here. And if you don't get those channels, go on YouTube and simply say Mid-Peninsula Recorder Orchestra, and it'll bring you to that particular site. So if you want to just kind of put it on in the background while you're having a holiday party or something, fine. It's great holiday music. And if you want to watch it, that's even better. So anyway, have a happy holiday, everyone.
Thanks, Fred.
Thanks, Fred.
Fred, you may already be aware of this, but for those who are not, you mentioned the importance of testing and finding out because the science is changing. A drug, AMG 510, just went into phase 2 testing for patients with a KRAS mutation. Yeah, and someone else we're close to in this foundation, her aunt was just accepted to that trial at UPenn. Is one of the first people on that trial for the phase 2. So.
Yeah, I should also say that I'm just winding up the my last sample for the clinical trial in Natera that 2 other people are involved with, and they confirm what the PET scans have shown, that there's no sign of anything. That's great. In the samples. But that's the other thing too, that you have to look for a clinical trial that kind of fits your needs. Obviously, I have a vested interest in this because if I can monitor any potential progression and catch it 6 months before a PET scan, that's fantastic. Yeah. Then we really know. So clinical trials are important, but they don't necessarily involve a treatment. They can involve a diagnostic technique, as you went through. Recently, you might want to mention that.
We'll see. We're getting low on time. Okay. Surprisingly, we're filling the hour. Yeah. But if anyone's interested, I volunteered. Nothing wrong with me. I did a full body PET scan. It's a new technology at UC Davis. I was there for 13 hours worth of different scans to help try and validate this technology and a new tracer technology. Hardest part for me was A, sitting still, and B, not being able to have caffeine for 24 hours. That was rough. So nothing what everyone else has gone through, but I wanted to contribute back to the science. So, yeah, thanks for bringing it up.
Francis.
Yeah, my name is Francis. It's 12 years ago now, December. It was around this time that they actually scheduled my surgery. I had a right upper lobectomy, Christmas Eve.
Wow.
That year. It was a very good Christmas present. And then I had chemotherapy in spring of 2008, cisplatin and etoposide. Chemo is just, it's a bitch. That's what I can say. And then since then, we've been, Rosalind, my wife and I have been very involved in advocacy. We've gone to DC several times and knock on doors, try and get money and try to get equal treatment. And it's a battle that will continue for a while. But thanks for doing everything you guys do. Go to, and happy holidays, everyone.
Thanks, Francis.
Thanks, Francis.
Hi, my name is Heather. I'm here because my mother was diagnosed in January of this year. And within a week, we were able to come sit down at the living room here and have a beautiful dinner and sit with a very welcoming community of people with the big hope on the wall and everyone speaking very comfortably about genetic mutations and drugs that they were exposed to and all of their different journeys. And that has been incredibly helpful. And we were able to walk away with some action steps and some knowledge to speak to the doctors with and to feel like we had some power in the situation to support her through her journey. And throughout the year, she's been coming, and this has just been an incredible community. And I want to thank you for being there for her and, supporting our family. Thank you.
Thanks, Heather. Evangeline. Oh, she's coming.
Yeah. Should be on.
It's on.
Yeah.
Hi, I'm Evangeline, and I was diagnosed March of 2017, stage 4 non-small cell lung cancer. I am EGFR positive. Actually, I was scheduled, I was assigned to a thoracic surgeon for a scheduled surgery on my upper left lobe of the lung. And day before surgery, I got a call that I have to have my head scanned. So 9 o'clock in the evening, I got a call that the radiologist saw 2 spots in my head, one on my right brain and the other on the left bone of the skull. And so they canceled my surgery, and the thoracic surgeon immediately referred me to a medical thoracic oncologist, and they immediately scheduled me for the targeted therapy, Tarceva. I started in May of 2017, and after 19 months, there was a progression on the tumor on the brain and the upper left lobe of the lung. Then I went through 2 blood tests, which failed, and finally my oncologist was debating it's either I should have a bronchoscopy or another biopsy. And then later on I said, I know what to expect on biopsy. Can I just have that instead of the bronchoscopy? So on May of 2017, I had a cyberknife radiation on my right brain. And it helped reduce the size of the tumor, as well as with the Tarceva that I was taking. But unfortunately, after 19 months, I had a progression. So based from the biopsy, I'm still EGFR positive. So I started Tagrisso in April of this year. And so far, the side effect, not so much, not as intensus the tarsiva, which is the diarrhea. So that's, I didn't have that anymore, but it's the skin problems, the side effect that are greasy, but it's tolerable and I have no complaints. I'm blessed that I'm still here, and I'm very grateful again. I'd like to mention for the beautiful family that I've experienced here in this foundation, and whenever I attend a support group meeting in Stanford, every new patient who's there, I encourage them to come here, and one of them is Gregorio. He was just diagnosed, and it's his first time here. Anyway, I'd like to greet everybody a Merry Christmas and blessings to all of us, that we will have a better, positive, and more healthy days to come in the coming new year. Thank you.
Thank you.
Thanks, Evangeline.
Amen.
Do you want to speak? Okay. I'm Pat Pritchard. I'm the oldest of 3 girls, and my second sister worked for the American Cancer Foundation for about 30 years, and my younger sister was diagnosed with brain and lung cancer. And so at the meeting with the sisters and her husband, they said, what is the life expectancy? And they said, well, 6 months. But we do have some new procedures to consider. And that's when CyberKnife came in. And so every 6 months, one sister in Rohnert Park and me in the Peninsula and my other sister in Oroville would meet in Sacramento. She'd get scanned in the morning and see the oncologist, radiation oncologist in the afternoon. And we'd meet with him after. And so this went on for 7 years. It went very well. I had previously had cancer of the appendix and saw Fred Marcus, who was surprised. He had never had anyone with that. Well, I met one other person that had that. Now it's becoming more common, including my nephew. So it's like, what the heck is going on? But I've had allergies and asthma all my life. And when I don't know what you say, but I just overreacted to a family cat on a trip. And I came home and I couldn't breathe, so I went to Palo Alto Medical Foundation, and they did a routine chest x-ray, breathing treatments, allergy pills, and all that. A year later, same thing, same trip, shame on me, stronger medicine, but came back, went through the whole procedure again, and when they did the x-ray, chest x-ray, they said, ooh, that spot that was there a year ago has grown. So that started everything rolling, including the PET scans, the CTs, the biopsies, and everything else. The day that it was confirmed that I did have lung cancer, stage 1, thank goodness, was the day that my daughter found this program, and we came here. And it was like parachuting into a foreign land. You don't speak the language. You don't know what's going on. But the food is great and the people are wonderful. So I've been coming ever since. And I've been learning a lot.
That's great.
It's BRAF positive and everybody has EGRF, and I feel like, oh, I'm the odd kid. But it's all working out, and all my scans have been good.
That's great.
And I'm just going to keep going and doing and want to give back. So thank you all, and Merry Christmas. Happy New Year. Let's all have a great year.
Yeah. Thanks, Pat.
Hi, everybody. I'm Gregorio, as Angelina said. Thanks to her, I'm joining this team for the first time. I'm a recent diagnosed myself. October 21st, now approaching my 2 months. I'm small cell lung cancer stage 4. Symptoms have been mostly coughing and itching, and those are preceding my chemotherapy. I am at Stanford being treated by Dr. Ramchandran, and let's see if I remember the drugs that I have. I'm having carboplatin, epotocide, and that's generally the word I cannot repeat. This Ulubomab, I guess, is the trade name is Tecentriq. So I hear this is a kind of standard way to start.
Yeah, that's great.
And I saw that there was a paper last year that tested for this combination of immunotherapy and standard chemo. So one reflection is, a very early reflection is that I'm kind of gradually transitioning into short-term disability, but the scheduling, the interpreting, and the triangulation of information across doctors is a job.
Yeah.
Yeah.
I'm realizing that I don't even make it to actually do all the triangulation I'm supposed to do. So that was kind of a news to me. I am originally Italian. I've been here in this country from 2002 and on this coast since 2008. But I'm blessed with lots of good friends that are helping me. So I'd be interested in meeting people that know more about second line of care for cases of small cell lung cancer stage 4. I'm kind of roaming the country to try to get second opinions. So I was at UCSF with Dr. McCoach to get a second opinion to check, essentially if the plan that Stanford is proposing is reasonable for her. She kind of validated it. It was at Dana-Farber. I don't know if you say Dana-Farber or Dana-Farber, but it's at Harvard Cancer Center last week. And there I saw Dr. Farago. And as of tomorrow, I'm going to MD Anderson as well to meet Dr. Byers, I believe. And she should see me in a couple of days. So kind of trying to use most of the sources of information I can. The hot topics for me, since I'm a researcher, is the whole brain radiation that they're all trying to push me towards. And it's really harsh for me to take that in.
Prophylactically, or do you have?
No, I have lesion. So I should say a little bit more of where my metastases are.
Yeah.
So obviously lungs, the right-hand side of the lungs. Then liver, there's 2 spots in the liver, 2 vertebrae, and brain unfortunately has lots of lesions with larger ones in the cerebellum. But there is kind of the broad pattern. So they all say standard of care is whole brain radiation, but I know there is damage. And since high functioning maybe take a hit, it's generally a very hard thing for me to take. So at this point, I'm still. So actually, the trip to Boston, they were really strong on this. So I'm kind of almost giving up. I'm not sure if I am yet giving up on this, on the idea of doing targeted, but that's where I am roughly on this. So any suggestions, ideas on?
Yeah. So do you want to say something? So a couple of things. There's some options to go back and discuss with the doctor if they do decide that whole brain, or if you decide that whole brain radiation is the way to go. Some patients have an option for hippocampal sparing whole brain radiation, which would be a big, plus. We have some docs that we work with at Memorial Sloan Kettering who specialize in exactly you. So you can talk to Michelle after the meeting, and then she can kind of help
Let's do that. Yeah.
facilitate that. Yeah.
One additional resource I found useful is Cancer Commons. Actually, a researcher, colleagues of mine, software researcher is there. It's in Palo Alto. It's a foundation.
Marty Tannenbaum, yeah.
Yeah.
Mm-hmm.
And so there is one researcher there that really is helping me responding to my email, figuring out what it means. And the one unfortunate fact is that my stamp panel at Stanford didn't show any marker. So she suggested me, okay, ask for a larger panel, which she called Tempus. And so now they're actually doing a new biopsy and getting that broader.
Good.
That's great.
That's great.
Standard, yeah. So thank you all for sharing. Thank you all for organizing this so well, including the recording, which I'm going to go back to.
Great.
And all of you for, Happy New Year. Yeah.
Thank you.
Yeah.
Thanks for coming. We're happy to have you.
One more hiding.
Yep, we got one more.
Good evening, everybody. My name is Renlong Joe. I was diagnosed lung cancer November back in 2014. From that point, I went through 3 rounds of traditional chemotherapy, and after that, my surgeon doctor basically took on, and I had my left lung pneumonectomy. So ever since, I've been checking every 6 months for 2 years, and then after that, every 2 years. Next April would be my 5th year's check after the surgery. So far I am also very lucky as a AED. So that's basically my quick story. What I'd like to add on to this quickly is that I've been learning a lot from attending this living room, and I also met a lot of friends and patient and learn a lot and get inspired a lot by them. And I also want to play that role as well as an advocate for the newcomers and patient and maybe potentially who is coming. And I heard a lot about the symptom that people, before they get diagnosed, to really quickly summarize it, that coughing, which I also have that. The second one I knew is that probably back pain. The third one is like a fatigue and also some kind of a weight loss. The weight loss part maybe is to some individual, but to certain people it may never happen. For me, I didn't have any weight loss, just coughing. And to Gregorio, probably he also have some itchiness. So these are the very common symptom to lung cancer patient. I think it's not very hard to convey this message to people who have this symptom when they visit their family doctor or internal medicine doctor. I think that from my personal experience, I think a lot of internal medicine doctor that as far as coughing, the first thing first, that they don't think that this is something related to the lung cancer. They think it's whether it's an allergy, that's number one. The other common coughing symptom caused could be like a stomach reflex, and the other one. But often, if they think this is the reason causing the coughing, and this can take like a month for them to finally say, oh, this is not allergy, or that is not because of a stomach reflex. So I'm not sure that whether we can send this message or we can back up this foundation to convey some kind of a strong message to alert the internal medicine doctor or family doctor. Whatever procedure that they established could be working very well, but as far as from a lung cancer patient perspective, I think they delayed the final diagnosis to a certain degree. Could be weeks, could be months. What that number of months or weeks means to the cancer patient could be a stage 2 become stage 3, could be stage 3 become stage 4. To those individuals, I think there's a significant delay. In my case, when I go first to my internal medicine doctor, she told me basically she likely is allergy. When I heard this diagnosis, it's just like, okay, if you were to tell me this is allergy to me, I knew myself, my body, because I knew that this is not an allergy for sure, although I'm not a doctor. Almost like, okay, if you were, having some throw up, You probably, get pregnant already. That's causing you throw up. It's almost as like ridiculous as that. But I can't argue with the doctor. I just want to say, okay, I'll go back, take whatever the medicine, that allergy medicine that I can take. Just take a while, maybe I'll come back someday to prove that's not the case. But I regret it that way, which is like 4 weeks later I went back. Then this time is my primary doctor. He thinks that, okay, not allergy, probably it's the reflex of your stomach. So again, when he said that to me, I kind of say, okay, maybe something wrong with my lung. Can we do something further? So he looked at my record and said, okay, looks like last time you had an X-ray is 10 years ago. I think it's worth it to take another X-ray, even though I don't think that's the problem after he listened to my lung. However, when I'm on the way driving home, he called me immediately saying, okay, you don't need to bother to get whatever medicine to treat your stomach reflex. Just come back, do a CT, because your X-ray shows big mass in the left lung close to the mediastinum. So at that time, he basically officially declared me something much more serious in my lung. Let's get on this quickly. So anyway, this is the case. I was thinking, had me diagnosed maybe a month earlier, maybe I don't have to go through my whole left lung pneumonectomy, maybe only a partially needed. But anyway, I can't regret more than that. It's just an assumption. But anyway, my message I want to convey to the people that in this room, or to all those people online, or whoever is going to watch this video later on, that whatever the protocol that your family doctor have, when you have symptoms like this, all this patient that shared all their symptoms, don't underestimate that the potential bigger issue and thinking this is something trivial or this is something light. So take that seriously, go further check, because for the lung cancer patient, time is very critical. Catch it early, diagnose early, treat early, your chance of surviving is much higher, and it's also beatable, this cancer thing. So do it early. Finally, wish everybody a great holiday season. Thank you.
Thank you so much, everybody. Wow. I mean, it's definitely, it's the holidays, and I cannot thank all of you enough for sharing your stories, your experiences, your recommendations.
They're gifts to each other and the people listening.
They are some of the best gifts, right? I mean, I can guarantee everyone in this room 100% that you have made a difference to somebody, either somebody watching or somebody that's going to come back and watch later. It's a huge, huge thing that you guys are willing to come here with the cameras and the lights. And I know the food's good and we're a family, but but it's deeply personal. And for you guys to be able to come here and just offer this up, I cannot thank you enough. So a huge, 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 huge thank you and round of applause to all of you in the room and those of you online for sharing. You are, again, the reason that we do this. So thank you for that. I'm going to go through a little bit of my housekeeping so that we can get back to a little bit more wine. But the next living room is January 21st, and we're going to be talking about integrative medicine. So we're changing it up a little bit. So I'm excited to be able to do that. That will be
day after my birthday. Bring presents.
Bring presents for David.
Yeah, just throwing that out there.
Yeah, we'll also the very next day. Michelle and our Senior Director of Science and Research out of our DC office will be hosting a living room in Atlanta, Georgia with the folks over at Emory. So we'll be having back-to-back, yes, and Amy's like her home to Amy. And then in the new year, we're already talking about 2020, our first two events coming up, I just want to kind of get it on everyone's radar, are February 9th in Southern California and February 15th in Arizona. So if you know anybody in those two areas who might be interested in participating in this awareness and fundraising event, please reach out and let us know. I want to give a huge thank you to David Leduc, not only my colleague, but my friend, for helping me sit up here and do this tonight.
My pleasure.
I really
Always.
appreciate it. To all the staff in the room who didn't get a chance to introduce themselves, just raise your hands. Let everybody know you're here. Thanks. I heard a lot of people talk about family tonight, and it is one of the things that it is not only who we are as an organization, but you guys are our extended family outside of that. So the bigger the better. So tell your friends and let them know that we're here. And with that, I'm going to close up with a thanks to Penn TV for all of their hard work, month after month after month, coming out here. Rocky and Cody are in the back. I don't know if somebody else is back there with them, but everyone out here. Go ahead.
No, I was going to say. Just a breath.
Yeah,
just
okay.
A breath.
The Office Bar and Grill, who did they donate any of the food tonight? No. Oh, we gave them a break tonight, but they do donate the food every other month. So thank you again to them. I already said to the go-to team, and then I need my glasses for this because it's a lot of people, but to the people who support this and without whom support we would not be able to bring it to you. AbbVie, Amgen, AstraZeneca, Bayer, Boehringer Ingelheim, Bristol Myers Squibb, Celgene, Daiichi Sankyo, Foundation Medicine, Genentech, Lilly, Merck, Novartis, Takeda, and Tesaro. Thank you, thank you, thank you. And last but very much so not least, happy holidays to everyone. And thank you to whoever brought dessert. I think Tina brought dessert, so huge. It did look amazing. I saw it in the kitchen.
Good when I came back from the golf.
Did it? Nice.
Thanks for saving it.
Yes.
Thanks for saving it.
And again, a huge thank you to Kim for putting together this holiday feast for us.
And Katie for helping get it set up.
Katie for helping get it set up. The entire team, really, thank you. Yeah, so let's continue the celebration, and I will see all of you in the new year, if not before. Thanks, everybody. I'm taking this.
We never end early.
Oh, I'll be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see. So I will fight if you'll fight. Yeah, I will fight, but only if you'll fight. Oh, we can make it through this like sailors in a tempest. Like sailors in a tempest together. And it could be just you and me. We'll be family. Just wait and see.